resonance on percussion. Now I'm going to just take a listen, okay? Take some deep breaths. Take a listen to the side. Now we're going to move on to the cardiovascular exam, okay? I'm just going to take a feel of all your pulses, okay? I'm going to feel your carotid first. All right. Feel your brachial. Okay. I'm going to feel your radial pulses. Now I'm going to feel the backs of your knees for these. Alright. And feel the tops of your feet. And the sides. Alright, and then I'm going to have you lay back and I'm going to feel your femoral pulses, okay? You can sit back up for a second. I'm just going to feel for your right here and have you lean forward a little bit. Perfect. And your PMI is midline. Right. Now I'm going to just take a listen, okay? I'm just going to listen with the bell of my stethoscope. Alright, now I'm going to have a listen with you laying down, okay? You can lay back down. Alright, I'm going to take a listen again, okay? This time with the diaphragm on my stethoscope. Alright, now with the bell. Alright, I'm going to have you turn your neck to the side. Okay, no JVD present. And turn to the other side. No JVD present at 30 degrees. Okay. Now I'm just going to put my hand on your chest and you just breathe normal and I'm just going to look for heaves, lifts, or throws, okay? Okay, and there are none present. Perfect. Now I'm just going to kind of percuss the heart borders, okay? now I'm going to have you sit back up. And we are going to do a little musculoskeletal exam, okay? I'm just going to feel right here and have you open and close your jaw. All right, no clicks present. We're going to test your cervical spine, so I'm going to have you bend forward, bend backwards, side to side, and then can you rotate? Perfect. All right, we're going to kind of test some of your joints, okay? So we're going to start with your arms. I'm going to have you, can you extend them? Perfect. Can you lift them? All right, can you go to the side? All right, can you put your fingers like that, put them together? Can you roll your wrist? Perfect. Roll your wrist. Okay, now can you lift them yourself? Above your head? Bend? Out? Perfect. Can you do your hands behind your back like that? Perfect. Can you lift them above your head? Perfect. All right. Can you roll your ankles for me? All right. Okay, can you roll them yourself? Perfect. All right, I'm going to have you lay down and we'll do some passive and active range of motion to your legs, okay? All right, so I'm just going to bend this knee, lift it. Can you pull it in? Straighten it out. Can you go this way? Can you go this way? All right. Bend. Straight out. Can you go that way? Can you go that way? Perfect. Now can you do that yourself? Okay, and go in and out. Perfect. Can you do this leg? Perfect. Okay. So we're going to do the straight leg test. I'm going to have you flex your foot. And can you just lift this leg? Any pain? Okay, I'll do it with the other leg. Okay, perfect. All right, I'm going to have you stand up and we're just going to look at your spine for range of motion and some scoliosis. Okay. Can you turn side to side? Can you bend forward with no problem? Okay, perfect. And I'm just going to take a look at your spine as you bend over, okay? All right. Spine is midline, no scoliosis. Okay. You can sit back down. All right. Now we're going to do an abdomen exam, okay? I'm just going to have you can actually go ahead and lay back for this exam. I'm just going to take a look at your abdomen for scars and any abnormalities, which there are none. All right. I'm going to take a listen first, okay? Starting in the right lower quadrant. I'm going to take a listen for any bruits, okay? No aortic bruit present. No renal bruits present. No iliac bruits present. No femoral bruits present. And bowel sounds were normoactive in all quadrants. Now I'm just going to percuss your abdomen just like I did for the respiratory exam, okay? Okay, perfect. Now I'm going to kind of percuss to see liver span, okay? Okay. Now I'm going to kind of percuss over here, see if I can feel your spleen. No dullness in the splenic area. All right. And no ascites present. Now I'm going to just kind of feel your abdomen. I'm going to do some light and deep touch. You tell me if there's any tenderness at all, okay? Any tenderness?
No.
All right, now I'm going to do some deeper palpation, and you tell me if there's any tenderness, okay? Any tenderness?
Mm-hmm.
All right, now I'm going to press down, and you tell me if there's any tenderness anywhere in your abdomen when I release, okay?
Mm-hmm. No.
Any tenderness?
No.
Nope. Okay. Now I'm going to try to feel for your spleen and your liver, okay? Spleen is non-palpable, okay? And now I'm going to have you take a deep breath, and I'm going to feel for your liver, okay? All right, you can release. All right, and liver is non-palpable. All right, now I'm going to just try to feel for your aorta, okay? Right here. Okay, and it's normal. And I'm going to have you sit up, and I'm just going to feel for any kidney tenderness, okay? You're going to turn kind of towards that, and I'm going to... Any tenderness?
No.
Any
No.
tenderness? Okay. Well, I think we've covered pretty much everything for today. Do you have any questions for
I
me?
don't.
All right, thank you.